वेलकम टू RRB NEXUS। इन आवर रैंडम क्वेश्चन एंड आंसर सेशन हमारा प्राइमरी गोल है कि आपकी परीक्षा से पहले हम सभी सवालों का कवर करें जो कि परीक्षा में सबसे ज्यादा संभावित हैं। और ये सवाल पिछले वर्षों के नॉर्सेट, AIIMS, RRB, ESI, PGIMR की परीक्षाओं के प्रश्नों पर आधारित हैं। Join us regularly to make sure your selection.
What is the color coding of the bag used in hospitals to dispose of human anatomical wastes such as body parts? A. Red. B. Black. C. Yellow. D. Blue.
And the answer is option C. Option C, which is yellow, is the correct answer for the color coding of the bag used in hospitals to dispose of human anatomical wastes such as body parts. The reason for using a yellow bag for anatomical waste is to ensure proper identification and safe handling of potentially hazardous materials. Anatomical waste refers to body parts, tissues, organs, or other biological materials that might be contaminated with infectious agents or pose a risk to human health.
Which vaccine can cause blisters and leave permanent scars in babies? A. DPT. B. BCG. C. Measles. D. Pentavalent.
And the answer is option B. Option B is the correct answer because the BCG vaccine, which stands for Bacille Calmette-Guerin, is known to cause a blister at the injection site, which can sometimes result in a small scar. Let me explain it in simple terms. The BCG vaccine is given to babies to protect them against tuberculosis, TB, a serious lung disease. When the vaccine is administered, it causes a small blister or bump at the spot where the needle goes into the skin. It's essential to remember that the benefits of the BCG vaccine in preventing tuberculosis far outweigh the risk of a small scar. The scar is a small price to pay for protecting babies from a potentially dangerous disease like TB.
Which colored 4 cannula is used for infants? A. Gray. B. Pink. C. Yellow. D. Green.
And the answer is option C. In simple language, in medical settings, different colors of 4 intravenous cannulas are used to show their size and purpose. For infants, healthcare professionals use a yellow-colored 4 cannula. The color-coded system ensures the right size and type of cannula for each patient. Yellow 4 cannulas are smaller in size, making them suitable for infants with smaller veins. Using the right size cannula is crucial for safe and effective delivery of fluids and medications to the baby's body. The yellow color indicates a 24-gauge cannula for infants.
Which of the following is the therapeutic use of paracetamol? A. Prevent nausea and vomiting. B. Pain relief. C. Motion sickness. D. All of the above.
And the answer is option B.
because the therapeutic use of paracetamol is primarily for pain relief. Paracetamol is a common over-the-counter medication that is used to reduce pain and fever. It belongs to the group of drugs known as analgesics, which means it helps to alleviate pain. While paracetamol can sometimes help with reducing fever, it is not primarily used for preventing nausea, vomiting, or motion sickness. For those purposes, other medications are usually prescribed.
Which of the following is the term used to describe surgical complications that result from foreign materials, such as surgical sponges or gauze pieces, accidentally left inside a patient's body? A. Surgical hemostatic syndrome. B. Gossipiboma. C. Idiopathic necrosis. D. Gossypium hirsutum.
And the answer is option B. Imagine you go through a surgery, and the doctors accidentally leave something inside your body, like a surgical sponge or a piece of gauze. That's a mistake and can lead to some problems. The term used to describe this situation is gossipiboma. So, gossipiboma is a word used by medical professionals to refer to surgical complications that happen when foreign objects are accidentally left inside a patient's body after surgery. These objects can cause issues like infections, pain, and other complications. It's essential for medical teams to be very careful and make sure they don't leave anything behind after an operation.
Which of the following suction pressure ranges is appropriate for performing endotracheal tube suction in an adult patient? A. 40 to 60 millimeters of mercury. B. 50 to 75 millimeters of mercury. C. 60 to 100 millimeters of mercury. D. 100 to 120 millimeters of mercury.
The correct answer is option D, which is 100 to 120 millimeters of mercury. When performing endotracheal tube suction in an adult patient, this range of suction pressure is typically recommended. The purpose of suctioning is to remove secretions or blockages from the airway, and a higher suction pressure within this range ensures effective removal of these substances. However, it is important to note that the exact suction pressure may vary depending on the patient's condition and the specific clinical situation, so it is always best to follow the guidance and protocols.
And for additional query, search on YouTube RK Edu Nexus, and get brief note on topics, join our Telegram channel, same name RK Edu Nexus.